It is Breast Cancer Awareness Month, and I titled this video Suck a Breast Today. Good day everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as the Nurse with the Difference, and I make learning easy and accessible for all my viewers. Today we are going to be talking about sucking a breast. Yes, we are going to be talking about the breast. I'm going to be correcting some little misconception about the breast. I'm going to be talking about the benefits of breast sucking. Then I'm still going to be talking about the signs and symptoms, some changes you should take note of in your breast and what you should do. But before we go into details in today's class, if you are new on our YouTube channel, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Miss Mary saying thank you. Let's go there. Alright, welcome back. Like I earlier said, today we are going to be talking about the breast, benefits of sucking the breast, and changes you should take note of in your breast. First of all, what is the breast? The breast is simply a tissue. It's a tissue overlining the chest muscles. Ladies or men, take a look at your chest. That chest muscles, those two things, those two oranges that are pointing outside, those two tissues that are outside that are beautifully attached to a lady's body, it's known as the breast. They are simply what? Tissues. For a lady, the breast is both functional and sexual. For a lady like us, the breast is both functional and sexual. It is functional in the sense that it is used for breastfeeding. We use it to breastfeed our babies. We use it to breastfeed our newborns. That is the functional aspect of the breast. It is sexual because it is pleasurable and it can actually make some ladies get to orgasm. But for men, there is no functional benefit of having a breast for the man, but it might have some sexual benefits. In terms of the breast, the space between the two breasts, we have the left breast and the right breast. That space, it's known as the cleavage. That space between the right breast and the left breast is known as the cleavage. Growing up as a child in around the community, you used to hear when they see a lady, like the breast is getting bigger, people start saying, oh, they are touching her breast. People have started there. A man has started touching her breast. A man has started sucking her breast. That is why her breast is growing. Sucking the breast, touching the breast does not make the breast grow. So that is just a misconception. It does not make the breast grow. And somebody asks, can an adult take breast milk? Do you want to know the answer? The sincere answer, yes. An adult can take breast milk. It actually is beneficial. It also has some health benefits, helps to boost the immune system. Same way that breast milk is important to the baby, that same way the breast milk is important to an adult. Though some men, when their wife is breastfeeding, when their wives are breastfeeding, they don't like sucking the breast because they don't like the milk. It's also beneficial. If you want it, you can get it from your wife and it can help you boost your immune system. Same way it's functioning for that your baby. And I also wanted to take note of the fact that between the age of 8 and 13, the breast grows, and at the age of 17 or 18, most times the breast is fully developed. So that is just some fact I want you to take note of about your breasts. Then that takes us to the benefits of sucking breast. All right, I know you are anxious. You want to really know about the benefit of sucking breast. So as a lady, you see the breast, the way it's been designed, it has some hypersensitive nerve endings. They call it hypersensitive nerves. That is sensitive. You understand when somebody is hyperactive in your head? That's the best way. So those nerves around the breast, they are hyperactive. They are hypersensitive. So when they are being touched, when they are being suckled, it's being stimulated. It can even get you to orgasm. We'll talk about that later. So they have some hypersensitive nerve endings around the breast. Same way a man likes to suck the breast, that same way a woman, most women, I can't say all, like their breast to be suckled. So in terms of the benefits, the first one is that it helps to balance the cardiovascular system. Yes, the cardiovascular system includes your heart. Yes, it helps to balance the cardiovascular system. When the breast is being suckled, it increases the heart rate of a woman. It increases the heart rate of the woman to 110 beats per minute. You can see. So suckling of breast is a good exercise to the breast. It's a good exercise to the breast. So that is that. Then the second one is that it helps the facial muscles. When the breast is being suckled, about more than 30 muscles around the face, they are moved. 30 muscles in the face are being moved. It increases blood supply to the face, to the skin, when the breast of a lady is being suckled. Then the third one is orgasm. Some ladies, they don't get to orgasm by other methods. Some ladies get to orgasm by breast sucking. And you know, when there's an orgasm, a lady gets extremely wet and the sperm can easily swim to the ampulla of the fallopian tube to get fertilized. That is that for that. Then the fourth benefit is that it helps to boost the immune system. Some antibodies are being produced. So when the breast is being suckled, it helps to boost your immune system. And remember that we said that when a breast is being suckled, it increases the heart rate. It increases the heart rate and it makes the lungs, it's like you are inhaling, you are breathing, like inhaling, exhaling, inhaling. It's helping to prevent some lung diseases. Yes, when a breast is being suckled, it helps to prevent some lung diseases. Then the other point I have to share with you is that suckling of breast may prevent breast lump. It reduces the risk of developing lumps around the breast. That is why when it's breast cancer awareness month, they always talk about sucking the breast because it reduces lumps around the breast, and these lumps can result in cancer. So when a lady's breast is suckled more often, it reduces the lumps around the breast. That takes us to changes you should take note of around your breast and attend to it as soon as possible. There might be signs of cancer. So if you notice any of these changes around your breast, please and please, it's advisable you see your doctor. That is why it is important as a lady to always check, to always examine your breast. See, your partner can also help you examine your breast. If your partner is the kind of partner that usually sucks your breast, so when he does that regularly, I believe when he wants to do it, when he wants to touch it, he might help you. It might just feel some lump like, oh, this was not here the last time I was doing this, but now it is here. You can see the benefit of also sucking comes in place because they tend to know, oh, there's a deviation from normal. This was how it is when I was touching it yesterday, but when I was touching it today, it's kind of deviated from the normal space. So these are the changes you should take note of. The first one is a change in the size of the breast. If you notice there's a change in the size of your normal breast, or one breast is bigger than the other, it is something that you should see your doctor about. Then secondly, a change in how it looks, how it feels. If your the breast all of a sudden is now inverted, you're not having inverted nipple, breast nipple that was pointed, all of a sudden it becomes inverted. Anything that changes the look of your breast is something you should see your doctor about. Then three, if you start noticing some lumps during your examination of your breast, you start seeing some lumps around your breast, it is something you should also see your doctor about. Then four, if you are seeing discharges, there was no discharge in your breast, all of a sudden you started seeing some discharges, you started seeing some things that look like breast milk that ought not to be there, please and please try and see your doctor. And another thing is a rash on the breast. If you start seeing rashes around the breast, you start seeing something red around the breast, please and please see your doctor. And also, if you have pain, all of a sudden you started having pains around the breast. We know sometimes during menses or ovulation, some women normally have some slight pains around their breast. But if that is not it, and you start having severe pain around your breast, swelling, redness, rashes, discharges, any different thing you see around your breast that is not there and has started coming, please and please try and see your doctor. Because once cancer starts spreading, one breast might be affected. Before you know, the second breast might be affected. Before you know, the two breasts might be amputated. And to get to a stage, if not dealt with on time, the person's life might be at risk, aside the two breasts being amputated or removed. So please and please, when you notice anything strange in your breast, different from what it usually is, please see a doctor. It is better to see a doctor and the doctor tells you you are fine than for you to assume you are fine and at the end something is wrong. This is just my candid advice to you all. Allow your hobby, allow your baby suck your breast. It is beneficial. It is beneficial. Your facial muscles are getting enough blood supply. Your skin is getting enough blood supply. Your lungs becomes functional. Your lungs is exercising itself. The heart is exercising itself. These are all benefits of breast sucking. That is why during breast cancer awareness month, they advise husbands suck the breast, and also they advise babies to suck the breast to prevent lumps and all those things from coming in. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye and see you in our next video.